Hi everyone, this is Dr. Saida Falafini from Cal Poly Pomona. In the first module, we are going to learn about healthcare system. What is healthcare? What is a healthcare system? And what are some of the main performance metrics that we use for the healthcare system? And one of the main drivers of the healthcare system. By drivers of the healthcare system, we mean those aspects that we can work on to improve the healthcare system. Okay, so these are the main points that I hope we can get from these slides. So what is healthcare? Healthcare is the maintenance or restoration of the human body because of diseases that have happened, injuries, or some illnesses that exist. Illnesses, for example, we may have some disabilities, but all the treatments that we get because of those illnesses or injuries or diseases are the ones that we put under the umbrella of healthcare. And these treatments are the ones that are going to help us to either maintain or restore our health. The maintenance part usually are the ones that help us in preventing diseases. For example, the annual checks and all the lab works that we do to see how are some of the metrics, some cholesterol and things like that, to see if anything is up or down and what are the reason. Those are some preventive measures that we do. And then if we do have an injury or disease, that's where we do the treatment actually to be able to restore our health. Okay, so all the activities that are done to maintain our health or restore our health from diseases, injuries, and illnesses, and all other physical or mental problems, those are the ones that fall under the umbrella of healthcare. Usually when we look at the healthcare, there are some performance measures, so some metrics that help us to see if this setup that we call healthcare system is working properly or not. The two most important one, or actually I can say the two that can really capture the whole system are quality and accessibility. I myself am working on a project actually in which we are trying to look at the healthcare provided for maternal mortality and morbidity, for the maternal situation in which leads to lack of that, the healthcare leads to maternal morbidity and mortality. But in that problem, we are going to actually look at the healthcare from two aspects: the quality of the healthcare provided and accessibility of the healthcare provided. There are a lot of other dimensions actually, and there are a lot of other dimensions, and in the rest of the slides, we're actually going to look at some of those. But the other two that you may see a lot in other studies are safety and cost. Safety, obviously, because it's such an important part, and cost because it's also extremely important in terms of if some people can have access to the healthcare or not. There are a lot of discussions or people argue that these actually safety and cost also fall under the umbrella of accessibility or quality. For example, cost is falling under the umbrella of accessibility because no matter if there are so many hospitals around you, they're available, they're accessible, but if the cost of healthcare is high, you still won't be able to access those hospitals. They are available, the availability factor exists, but they are not accessible because of the high cost that they have. So there are arguments that actually, if you consider cost as a factor, cost actually is one of the factors that falls under the umbrella of accessibility. And of safety also is one of the factors that falls under the umbrella of quality. Obviously, we want the patients in any healthcare setting to be safe, so that if they stay safe, that obviously affects the quality of the healthcare that is provided. So the two main metrics for any healthcare setup are quality and accessibility. But as I said, there are a lot of others that you see. But when you think about them, you can pretty much put every other metric under the umbrella of accessibility, which is all about having access to the healthcare, and the quality, which is the quality of the care that you have received. Now, healthcare system or health system. A healthcare system consists of all organizations, people, actions, procedures, rules that work together um, to maintain and restore the health of individuals, right? We define what is healthcare, but all the system, all the organizations, people, actions, procedures, rules, and regulations that enable this action to happen is the one that we call as healthcare system. Okay. And you all have seen, I think you all, I think everyone has had systems engineering class. So, and you all have seen what is the definition of a system. A system is a set of interrelated components that are working together to achieve a common objective. So they are together to achieve a common objective. So, and the same is for a healthcare system, interrelated components, hospitals, pharmacies, X-ray rooms, MRI rooms, all the labs, all the nurses, doctors, clinicians, all the staff, all of these are components of the system that are working together to achieve some common objectives. And obviously, the most important, or the one and only objective of a healthcare system is to be able to, as we said, to maintain and restore the health of individuals. Okay. So when we look at the healthcare system, we talk a little bit about the components, but usually in healthcare system, we have providers. These providers are hospitals, clinics, all nurses, doctors, surgeons, all of those. Okay? They provide the healthcare to patients. However, there are also insurers, so these providers should be paid, right? So insurance companies, either private or public, are the ones that provide, that pay the providers for the service that they offer. However, these insurers need to get that money from somewhere. That happens when patients buy insurances, right? So we pay for our insurance. Also, our employers are the ones that also contribute or participate in that in that process of buying the insurance. And sometimes even patients pay the providers from the pocket, and that's absolutely okay as well. I myself have, through the university, have Kaiser, and Kaiser is good in a lot of aspects, but sometimes for some services, it's just so hard to get a hold of them that I just gave up and went to the doctors that I saw out of the network and just paid from the pocket, and that was fine to me because my health was more important for me. And so the patients may also end up paying the providers from the pocket, and that's perfectly fine. We also have government that is working with the providers and also may end up paying the providers through, for example, Medicaid, which is the insurance that government provides for people that have low income level. Medicare, that government provides for senior citizens. So government also provides a lot of insurance programs that leads to government basically paying the providers for the service that providers provide to the population. Also, when we talk about the insurance, you probably have heard this. We have all these cases of HMO and PPO, where in the PPO scenario, we have, in the HMO scenario, we have a specific list of doctors that we can go see, but in the PPO, the list is not pre-specified. So it's a little, you have a little more option in terms of who to choose and so forth. But these are all fall under the category of insurers, are they either public or private. We also, in this healthcare system, in addition to hospitals, patients, insurers, governments, and employers, we also have those health device manufacturers, those who make those health devices that are used in the healthcare system. We also have pharmaceutical companies, which basically create all the medications that we are going to use, and those medications go to the pharmacies, and pharmacies are the ones that will be then working with the providers, hospitals, clinics, and so forth, or directly with the patients to provide the medications that is needed for these units. And we also have a lot of research institutes related to the health system, either the ones that are working on inventing new medications, or the ones that are working on inventing new methods or new equipments or new devices for dealing with some of the diseases. And also, as another component in the healthcare system, we also, before that, government also plays another role in this system. Government also puts some rules and regulations on this system, especially on the pharmaceutical companies. And so the government is related with some of these other components through the rules and regulations that the government puts in place. And another component of the healthcare system will be some NGOs. Those are the ones that have fundraising. There are a lot of foundations, for example, Armstrong Foundations. There are so many other foundations that exist that they raise money and they spend that money for on the pharmaceutical companies, on the healthcare devices, on the R&D processes, or even they provide the money to some providers. So there are a lot of hospitals in the geographic areas that they may not be equipped. So a lot of these NGOs provide money to those hospitals and so forth, so that they buy some of the equipments, so they can provide a better service to the population in that area. Okay, so when we look at the healthcare system, these are basically some of those main components. When we say the system is a set of components working together to achieve some common objectives, these will be a schematic representation of some of the main components in the healthcare system. And they are the ones that are listed here as well. So these are, I call them stakeholders for components, but customers, patients advocacy organizations, clinicians, doctors, hospital system itself, the buildings and so forth, all the labs and so forth, insurers and employers, healthcare industry, all the manufacturing, all the manufacturers, healthcare research and all the R&D that happens, and finally government and all the policies that government puts in place to make sure that the healthcare is provided to the population. Okay, so these are some of the main components or main stakeholders in the system. Here, for example, in terms of the effect of the government, I know that government also has some rules through the Medicaid and Medicare. I know there are some quality standards that the government has put in place in terms of the Medicaid that is provided to people with lower lower economic status. There are some services that they have to provide to this population; they cannot deny them, and there are some quality measures that they have to meet for sure. Here are a couple of graphs to just show you, okay, in this healthcare system, we get a sense of spending. So US, you have probably heard, actually has a rank 1 among all the nations in terms of spendings for the healthcare expenditure. This graph shows the spendings over the past 50 years, from 1920 to almost 2020. And the green graph shows the value of the healthcare's expenditure, going from something below 200 billion to something about 3.8 trillion. Okay, over the span of 50 years. And obviously here you may say, okay, there's inflation going on. Obviously, each year as we go forward, there is more money spent, but this doesn't mean, but it's just because of the presence of inflation. So this black curve actually is the one that shows the healthcare expenditure based on the 2019 dollar. Okay, so it has evaluated all the money in each year based on the value of the money in year 2019, and even with that, when every single dollar expended in each year is based on the value of the dollar in 2019, we still see there's a significant increase in the healthcare spending going from 1970 to 2020 in 50 years. Okay. And again, this is the healthcare expenditure for everything, for all the healthcare that is provided in the hospitals and clinics and so forth, for the population health. For example, right now with the case of COVID, we have the vaccination that is provided to the population. All the money that is spent for providing vaccination to people, all the tests and everything, all of that also is in this cost. So the healthcare provided in the hospitals and clinics, the healthcare that is provided to the population, similar to the vaccination process, the money spent by insurers and so forth, all of that are considered in the healthcare expenditure here in this graph. And when we look at the components of the healthcare spending, based on the data collected in 2019, we see that there are three components that form actually about 60% of the total spending. 20% are the money that are going to physicians and clinics and hospitals and so physicians and clinics. 30% is the money that is going to the hospitals and all the operations that they do. And about 10% actually, which is huge, is the money that is going to the prescription drugs. The rest are about 4%, 3%, and so forth that are going to the dental or nursing homes and so forth. And then here, the other components are more the administrative part of the process that goes into the other part. But physicians and clinics, hospitals, and prescription drugs are 60% of the total spending. These are the three major components that basically form the main part of the healthcare expenditure. And here, there's a comparison between some of the countries in terms of their healthcare system. The two overall metrics, again, as we talked about in a couple of slides before, are the quality of care and access to care, accessibility and quality, remember? So under the quality of care, we have effectiveness. Does the healthcare do the job that they're supposed to do or not? Do they make people better or not? The safety, obviously. Coordinated care, when people need to go from one hospital to another, from emergency room to the hospital, from one hospital to from one room to, let's say, operating room and so forth. What is the level of coordination? Do people end up losing their information? Are there errors and things like that? So those are what we call under the what we put under the coordinated care. And then a patient-centered care. So this is also a term that we're going to use in the class a lot. Patient-centered care is also important because nowadays the healthcare is tried to be more patient-centered, looking at the values and the need of the patients a lot more, and try to provide a care that is going to consider those values and is going to also involve patient in the whole decision-making process. And then when we talk about the access, obviously the cost, as we talk, is one of the factors that lies under the access, because no matter how many, as I said, how many hospitals there are around you, if you cannot afford, still you don't have access to those hospitals. So the cost is definitely important. And then the timeliness of care. So yes, there are a lot of hospitals around you, but all of them are full. So you need to get a hold of a doctor, or you need to get a hospital bed, but it takes a month, and by that time you may your health condition may have gotten worse. So the timeliness of care also is another factor that falls under the category of excess. And then here there are a lot of another factor here we see is equity, and it's actually one of the factors that we may see in the performance of the healthcare system. And nowadays, thankfully, government and also local and federal government pays a lot more attention to the equity factor, and equity tries to capture if people from different genders, different races, different socioeconomic backgrounds would receive different level of healthcare. Unfortunately, in the US and a lot of other countries, that situation exists, that sometimes race or gender or other factors have affected the quality of care that different people have received. So that's the one that is captured under the equity factors. And then finally, the total healthcare expenditure. So this ranking, total ranking, as you can see, is on the top. And I'm not surprised that US is the last one among these 11 countries. I'm a little surprised actually that UK is the first one. I expected some of the Scandinavian countries to be a better one, but UK has gained rank 1 in a lot of factors actually. So Canada, as expected, also it's not doing well. The universal healthcare that has been provided in Canada. I have friends who are living there, and for them, timeliness, I mean, is always a factor that I have seen they complain about, because also they have to stay in long lines before they can finally get a hold of the doctor and so forth. And for the US, the cost is definitely an important factor. US has the highest cost among all the nations. So as you can see here, this is based on the data on 2011. Based on the data of 2011, the healthcare cost per year per person is about 8,000. Based on the data that actually I saw in 2019, that number has increased to about 11,000, 10,700 to be exact. So in a matter of 10 years, like 2,000 more on the overall cost per person in the healthcare system in the US. And but overall, we can see from this graph that how some of these countries are performing with some of the factors, and most importantly, how US is doing. The cost definitely is one important factor that is lagging behind. And then access also, mainly because of the cost, but the timeliness is not bad. Timeliness is fair in the middle, but I think the overall score of the access is low. I mean, it's high. I mean, it's poor, mainly because of the high cost. Because again, the high cost causes a lot of people not to be able to have access to the healthcare. Okay, but the quality of healthcare that is provided is, I would say, in the middle, medium level. But the overall ranking of the US healthcare system is low and the cost is high. So you see here that obviously this system, this healthcare system, needs a lot of improvement to improve its performance, not only in terms of the access, but also the quality of care that is provided to the population. So why there are some of all these differences that we see in quality of care and accessibility to the healthcare system among all these countries? Some of them obviously depends on the policies, healthcare policies that is in place by a lot of these countries. So US unfortunately does not provide much pressure in terms of providing some universal healthcare. Yeah, obviously the Affordable Care Act is trying to do that, but there are a lot of political resistance for Affordable Care Act. But also it depends on the demographic of the population and the social and economic status. When in the next couple of slides, we talk about how the demography of different countries affects the total ranking that they have in terms of the performance of the healthcare system. Okay. And why in the US we have such a poor performance? Obviously, lack of universal healthcare. There are a lot of people before Affordable Care Act. There were a lot of people who didn't have access to the healthcare. I myself had students who didn't. I remember that at some point I was talking to a student who had some health issue, and I asked him, like, why don't you go to a doctor? And he said, I don't have health insurance. And that was just so hard for me to hear, that such an important thing cannot be treated just because people do not have access to the healthcare, and because the health that is provided is extremely expensive. So a lot of people wouldn't be able to afford it. So lack of universal healthcare definitely is one. And there is the healthcare information system is an information system that is in place and helps different units, hospitals, clinics, and so forth to manage the data of a patient. And if a patient is supposed to go from a clinic to a hospital, from an emergency room to a hospital, this health information system is supposed to help with the flow of the information of that patient through all these units. However, the health information systems in the US have not been doing well, and that has been one important reason for a lot of medical errors that actually happen in the hospitals. And then another issue that US has, and actually I'll talk about it a little more in the next couple of slides, is the presence of chronic conditions in the US, such as obesity, blood pressure, diabetes, issues related to that are raised with smoking too much or drinking. So all these chronic issues that also exist in the US make the population to be prone to a lot of healthcare issues that can happen. And when the healthcare system cannot provide the service that this population needs, that's when the difficulty is seen. So that's when we have a lot of patients that are not happy and they're worried about their health because the system cannot answer the demand that exists. So here I'm going to talk about some of the drivers of the healthcare system. And as I mentioned, that when I talk about the drivers of the healthcare system, I'm talking about those factors that potentially we can touch, we can push, we can correct and improve the performance of the healthcare system. The financing mechanism, obviously, the whole cost associated with the healthcare system, those are the ones that can be improved. Population health and wellness, that's the one I just talked about all these chronic issues that exist in the population, but that's the one that can also be touched and improve the healthcare system. How we can improve access to the healthcare system and and also how we can improve quality of care that is provided. And finally, electronic health record, EHR. I missed the parentheses here. So the electronic health record also is something that I'm going to talk about. What are some financial drivers? And as I said, when we talk about drivers, those are the things that we can potentially touch, we can potentially improve to improve performance of the healthcare system. So obviously high cost, as I showed, US has the highest cost among all the nations per person in each year. And these high costs has been one of the main barriers for using the healthcare system, for the effectiveness of the healthcare system. And what are some contributing factors to the cost? Technology is definitely one. There are a lot. There is as the technology for providing care increases, the price that is provided increases as well. Although sometimes even there is no clinical proof that the technology or a better technology has led to better service. For example, I know that I read actually in a paper that for prostate cancer there is the proton therapy compared to the chemotherapy, and the proton therapy was the one that was developed later and has a higher technology, and its cost apparently twice the other one, but there's no clinical study or proof that it is more effective for the patient. However, a lot of hospitals may use that and charge the insurance all that money just because it's a later technology, but there is no clinical evidence that higher technology has actually led to a better service to the system, to the patient. The manufacturing technology, on the other hand, decreased the cost. I think in the slides that I have put, this is increased. I'll upload the updated one. But as the manufacturing technologies get advanced, the manufacturing process works better. The cost of manufacturing all the devices and equipment is lower. So as a result, the cost that these devices are provided to the hospitals are lower. So the technology of treatment, the improvement in the technology of treatment leads to the increase in cost. That makes the treatment more expensive. However, the improvement in the manufacturing technology for making those devices and equipments, that will bring down the overall cost, because then the manufacturing process will be done a lot more efficient and faster. Population aging also is another factor that can cause to the that can contribute significantly to the higher cost of the healthcare that is provided, and that's actually a significant public health issue in Japan. US, for example, has the issue with the obesity. That's one of the major public health problems in the US. In Japan, that's not the case. Population aging is a significant public health problem in the US, in Japan. The average age of the population is very high. There are a lot of people that live through their 80s and 90s, and these people live, but they have a lot of health issues, and the country and the healthcare system ends up paying for all those health issues and health problems, and that leads to the high healthcare costs. The price of prescription drugs obviously is high, so that's 10% of total healthcare costs. That's a lot of money, and there are a lot of also pharmaceutical companies that charge a lot for some of these medications that they provide as well. Sometimes a lot of incentives that are provided also contribute to the high healthcare costs. For example, incentives that the government provides for going and doing vaccination, incentives that government provides for, or the healthcare system provides for doing some monitoring on the healthcare condition, so that they can prevent, so they can detect some type of cancers a lot sooner. For example, the mammography that is recommended to women after age of 40, it has to happen every year, and that's a costly operation, but they have found that probably doing that would lead to the less cost compared to the scenario when we let the cancer happen and then all the complication and the cost that happen afterward. And the wealth of the country as well. Obviously, some countries are wealthier and they can have access to a better technology and better manufacturing processes, and that may lead to the higher costs in the healthcare. And some countries, unfortunately, do not have that possibility and that resources as well. But these are all the factors that contribute to the high costs that we incur for the healthcare system, which is one of the barriers, as I said, in terms of having access to the healthcare system. Population health, I mentioned that a little ago. When we talk about population health, obviously obesity and eating is definitely one factor. Excessive eating, excessive drinking, and also smoking. These are some of the behavioral aspects that affect the population health. The challenge is that when the excessive eating leads to overweight and obesity. Overweight and obesity leads to so many other health complications: hypertension, diabetes, 8 types of cancers, stroke, and so many other things that can happen because of presence of obesity. And actually, a recent study by Harvard University 2 years ago showed that obesity is a major risk factor for those health complications. Before that, people know, or doctors know, or researchers knew, obesity is a risk factor for 8 types of cancers, for diabetes, for blood pressure, and so forth. But that study 2 years ago at Harvard University found that obesity is a major risk factor for all those health complications. The CDC estimates that about 300 billion of annual medical costs is spent on all the health complications that are caused because of the smoking. And I think the number that I read in a paper was about that we have about 6 million deaths each year because of excessive drinking. And similarly for the obesity, as I said, all these health complications that happen afterward, cancer, stroke, hypertension, and so forth, those are the ones that needs healthcare system, and those are the ones that leads to spending in the healthcare system. However, all of these are preventable. If people can handle their excessive eating or drinking or smoking, they don't develop those health complications, and they don't need the healthcare system. And all these billions of dollars that are spent on these health complications are the ones that can prevent it. That's the one that I think hurts a lot of policymakers and decision makers, because all of that money is preventable, and it's the money that we can spend on education, on infrastructure, and so many other things. But they are the ones that's the money that they spend on a lot of health complications that can be potentially prevented. So that's why I consider population health and wellness as one of the important drivers of the healthcare, because if we can improve population health and wellness, we can actually bring down the healthcare costs that a society or a country is going to incur. Quality of care. First of all, we do not want to provide any harm in a healthcare setting. There are a lot of situations where people go to the hospitals and they get infection in the hospital. There are a lot of times that the data that has been transferred from one department to another associated with the patient has not been done correctly, and the patient has received the wrong treatment or an incomplete treatment, and it has lowered the quality of the health that has been provided to the patient. So the quality is basically the extent of the service that we provide to the customer, so that we meet all the requirements and all the needs of that patient. So if a patient comes with some health malfunction, have the hospital setting been able to address those situations and lead to the discharge of the patient with a better health condition or not? So there are a lot of malfunctioning that happens in the hospitals, as I said, because of the infections that receive, because of the malfunctioning of the health information system and so forth, that lead to the low quality of care. So, and that also is the one that participates in total healthcare costs. And one other factor that I want to talk about is the electronic health record. So also this is an important term that I want you guys, you probably have heard this term, but also this is an important term that I want you guys to know, because it has been used a lot, or it is used a lot in a lot of healthcare settings, and it has a very significant impact on the performance of the healthcare settings. So it has a broad range of information systems, and that help to electronically keep information of a patient and electronically transfer information of the patient. That's the one that Sahar mentioned, that she had help in a hospital to transform all the document-based information of customers to electronic information of customers. So those are the ones that we keep in electronic health record or electronic medical records. You may hear that as well. So what are the benefits of using electronic health records? Electronic health records reduce the possibility of errors. When a patient, for example, goes from one unit to another, patient goes from emergency room to the hospital, the electronic health records let the same information from the patient to be seen in both emergency room and the hospital. And that's important because that will lead to the reduction of errors. It's a more streamlined workflow. So as the patient goes from one department to another, she or he can carry the information, and that helps and it streamlines the process. And over time, there is a possibility of better tracking of what has happened to the patient, what are in different treatments that the patient has gone through, and what is the next set of actions that should be taken for the patient. Actually, these electronic health records were created and widely used in the US in 2009 after the passage of Health Information Technology for Economic and Clinical Health Act. So that's a policy that was enacted in 2009. That's the one that forced the healthcare system to use the health information, the electronic health record or electronic medical report. Before 2009, only 20% of the doctors in the US were using electronic health record. The rest, the other 80%, had the paper version of information of the patients and so forth, which obviously was so hard to keep and update. What are some of the challenges for implementing electronic health records? Obviously, the cost. It has a high cost for creating the system and maintaining the system. And these electronic health records should be able to operate with a lot of the other form of the technology that is in the hospital setting. For example, sometimes there are some equipments or devices in the hospitals that measure some metrics of the body, so blood pressure or level of oxygen in the blood, or temperature and things like that, and they can automatically transfer that to the electronic health record system. So sometimes the presence, the making sure that the electronic health records can communicate with all these other equipments and devices is also a challenge. And also security of the data and privacy concern. That's also another important concern. I know, for example, in the healthcare and public health, there are a lot of data that are provided to the researchers so that they can look at the data and look at the patterns that exist, and they can say something about some of the causes of some of the problems that exist, or some to basically learn from the data to see how the data can help them to provide treatments or say something about some risk factors that may exist for the population. And I know that there's always a lot of permission and that you have to go through. There's a long process till we finally can get a hold of some data set related to the patients. And even when we get the data sets, there's no way for us to be able to detect at all who this health record belongs to. All of them are what they call as de-identified. So they remove all the identification things that exist in the database. So at the end, you have no idea who this data belongs to, which is perfectly fine. There's no need for such a thing, but that also puts a lot of creates a challenge for electronic health records and how the healthcare system can make sure the data is secure. And so one last thing that I wanted to mention before we move on to the next discussion is something related to delivery of the healthcare system. So obviously the provision of health services to the customers is what we call as delivery of the healthcare. So we hear the term healthcare delivery a lot. So I want you guys to know, what does that mean? Healthcare delivery is the provision of the healthcare to the patients, to the customers. And as we talk about the healthcare delivery, sometimes we have patient-centered care and sometimes we have population-centered care. So patient-centered care is basically what a lot of healthcare systems are going to go to. That's the one in which they try to include patient more as an active member of the team as opposed to a passive member. And they focus on the values and the needs of the patient, and they try to consider all of those in the treatments that they provide. This is as opposed to the past, where patient was more of a passive member of the team, and the doctors and nurses and clinicians and technicians would decide on what should be done, and they would just implement it. But now it has happened to me, it may have happened to you guys as well. Sometimes when I go to doctor for some health complications, so they tell me, okay, we can do this or we can do that. So which one do you prefer to choose? And that actually sometimes is good or bad, because sometimes some people do want to be involved in this decision-making process, but there are also some people who do not want to be involved in this process. So they expect the doctor to be the one who knows everything and who can make the best decision. So they want the doctor to be the one who makes the decision in terms of what should be done next, and that's it. But in any case, that type of healthcare that tries to bring the customer in as a team member, provides all the information to the customer and looks at the values and the needs of the customer and tries to take all of those into account in making the final decision, is what we call a patient-centered care. As opposed to a population-centered care, which is around the health needs and expectations of the community. So for example, when the healthcare system provides the services for the vaccination. So this is the system, this is the service that the population wants, that the community wants, all the services related to vaccinations, where we can go to get tested, where we can go to get vaccinated, and so forth. So that's what we call a people-centered or a population-centered healthcare delivery. Okay. So what I tried to do in this presentation is to tell you, first of all, what is a healthcare and what is healthcare system, all the organizations, people, rules, and regulations that provide healthcare to the population, try to maintain and restore the health of the population. That's what we call a healthcare system. We look at some of the important performance metrics of the healthcare system. Quality and accessibility were the two most important, but as you saw, there were other things like cost, timeliness in access, equity, for example, was another one that we looked at. And so there are several other factors that we can use to measure how well a healthcare system has performed. But again, we pretty much can put every performance metric under the umbrella of quality or accessibility. And the quality or accessibility of healthcare in any country is affected by the health policies that the country has. And it also is affected by the demography of the population, like the ones that we just talked about, as well as social and economic conditions. And also, I think the most important takeaway here is that the healthcare is a complex system. We'll talk about that a little more in the next presentation. But the complexity of the healthcare system can lead to the patient harm and can affect the healthcare quality, access, cost, safety, equity, and all those performance measures. So all of these performance measures can be affected because of the complexity of the healthcare system. So healthcare system is a big system. It is a complex system. It has a lot of issues. In the US, it has high costs and is not as accessible to a lot of people. And the complexity of the healthcare system is one of the factors that actually has contributed to a lot of these issues that we see. Okay. So, as I said, my goal here was to give you a sense of what do we mean by healthcare? What do we mean by the healthcare system? What are some of the main components of the healthcare system? How different countries are performing with respect to each other? How US is performing globally in the global spectrum in terms of the quality and access to the healthcare, which we saw unfortunately is doing poorly. And lastly, what are some of the drivers of the healthcare system that we can potentially touch to improve the performance of the healthcare system?